Thanks for joining us today. Welcome to the Center for State's video series on the 7 functions of intervention selection and design adaptation. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. In this module, we will discuss the steps to determining whether interventions are well-defined, essentially whether they are usable and transferable to the agency system. As a reminder, teams should have already researched possible intervention options and assessed the evidence, fit, and feasibility of an intervention before moving on to decide whether to replicate or adapt an existing intervention or design a new one, defining the intervention, developing a proposal, and then further defining and operationalizing the intervention as needed. In the first video in this series, we discussed well-defined interventions. Remember, well-defined interventions include 4 key items that help teams communicate, implement, monitor, and evaluate interventions. These key items include a clear description of the intervention and the intended target population, core components that define the essence of the program and represent the key building blocks leading to positive outcomes, operational definitions, or the specific actions and behaviors required to carry out the core components of the interventions, and practical performance assessments that define how to monitor the intervention. While assessing evidence, fit, and feasibility of possible interventions, teams gather and review as much information on potential interventions as possible. This can help teams determine if there is enough information about an intervention to replicate or adapt it. Without being well-defined, an intervention can be difficult for teams to fully implement. Teams must consider if there is enough information and guidance available for a selected intervention so that they may explain and teach it to staff, implement it, and monitor to see if it's working as intended. Supportive materials such as manuals, fidelity criteria, and assessment tools can help a team determine if the intervention is well-defined or usable and transferable to their setting. Teams working to determine whether potential interventions are well-defined should collect and review information for the following questions. Is it clear what the intervention is? Can the intervention be easily explained to others? Is the intervention usable? Does it have a clear description, core components, operational definitions, and performance assessment methods or tools, essentially a fidelity process? If the program will be adopted from another source, is it easily transferable? Is there enough information to replicate? If the intervention is untested, can it be evaluated? In addition, teams should consider the following. Do the potential interventions have the key criteria of a clear description, core components, operational definitions, and practical performance assessment tools? What materials are available to support implementation that are teachable to staff? For example, practice profiles or training manuals. And what are the underlying philosophies, values, and principles? Do they fit with the agency's values and principles? When teams take the time to consider these questions with each potential intervention as part of their assessment process, the information will help support selecting an intervention that is usable and transferable for the agency's needs, or choose to adapt or design a new intervention. Let's take a moment to check in on what you've learned about determining whether interventions are well-defined. Why do teams determine whether interventions are well-defined? To determine if there is enough information that they can explain it, teach it, implement it, and monitor it. How do teams determine whether interventions are well-defined? By determining if possible interventions are clear and easy to explain, usable, have operational definitions, and fidelity or performance assessments. What can help teams determine whether interventions are well-defined? By looking for key criteria for usability enough materials to support implementation, and alignment with agency principles and values. Now, take this a step further by reviewing the reflection questions and practice exercise for determine whether interventions are well defined in your intervention selection and design adaptation workbook to connect what you've learned to your own experience. Up next is decide to replicate or adapt an existing intervention or design a new one, the fourth function in intervention selection.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.